Good evening, Heart for the Community Initiative. Welcome back, everybody. We have another very, very exciting and informative interview for you today. For those of you who are new to the program, I am Carl Armstrong. I am Director of Operations for Heart for the Community Initiative, and I'm also the host for our interview series. It was our attempt when the restrictions first started through the pandemic to try to stay in contact with our audience. And we're doing that by way of the interview series. And it has, kind of had a life of its own now. So today we are highlighting Sentara Healthcare. There are rehab and therapy services. And right now we have with us Dr. Kenneth May, who is a chiropractor. And we also have speech therapist Emily Collado Lugo. Did I say it right, my friend?
Yes, that's correct.
Wonderful. And we think that team coordinator Sarah Sidar will probably be joining us in session. And I just wanted to give an opportunity, and there's my number one fan, my wife, saying good evening, y'all. She's also a fan of Dr. May. For all y'all who don't know, Dr. May is the chiropractor for Tisha and I. And so I can speak firsthand of the level of service and professionalism. They're good people, they're kind people. And we want to let you, the community, know what services are available for you through Sentara's therapy and rehab center. So without further ado, I'm going to let the experts talk. Dr. May, Miss Emily, welcome to Heart for the Community Initiative.
Thanks, Carl.
So at Sentara, we have two therapy centers now. We have the Reed Therapy Center where Sarah's at right now, and she might be calling in or joining in on the video at some point soon. They're open a little later today, so they're probably still with patients right now. Emily and we finished a little earlier today. We just finished up our charts and hopped on here with you guys. Both offices offer a whole bunch of different services, and I'll tell you about them, but the biggest thing to know right now is that everything we're doing here is extra clean, it's extra safe. And even before COVID, we're neat freaks anyway. So everything's clean before, after, top to bottom, left to right, because we're departments of the hospital. So we have to make sure we're following the strictest of regulations, strictest of guidelines. Everything needs to be A+ all the time. And it's the same right now. So whether if you have some kind of health concern that needs chiropractic, acupuncture, physical therapy, occupational therapy, speech language pathology, pediatric speech language pathology services, and hopefully here soon enough massage therapy and some other forms of therapy. We're trying to have a little bit of everything. We are open physically, as we always are. We're just making sure that we have reduced numbers here, so it's a little quieter, a little more intimate experience, less people in the office, trying to keep it very safe, very spaced out. But we also have telehealth services, both for evaluation purposes, if you're wondering what's going on, or if you need to check in or go over exercises or therapy. We're doing all of that. All of us are. At Century, we are here. I'm offering our chiropractic services, which is primarily neck or back related. Also our acupuncture services, I offer those. More of a traditional Chinese medicine approach blended with our Western medicine. So I can work with your oncologist if it's maybe nerve pain from chemotherapy from cancer, or if it's muscle pain from throwing your back out, raking leaves, or playing sports. I make sure we kind of blend up all of those worlds together and do whatever's going to work best for you, and make sure we're working with your team. Puneeth is our physical therapist at this office right now. He's at another location today, otherwise he'd be here with us right now. And he's offering a wide array of any physical therapy services you would normally think of for an adult population. So orthopedics, if you had an injury, before surgery, after surgery, muscles, bones, tendons, ligaments, that's his thing. He'll get you moving, he'll get you healed up, he'll get you stronger.
So in my case, I offer services in the areas of expressive and receptive language. When we talk about expressive, it's the ability to use language to express the thoughts, and receptive, the ability to understand language. I also offer services in the area of articulation or sound production skills. fluency. For example, if a patient has difficulty or has a stuttering, feeding difficulties, and also social skills. I treat patients with autism and help them to communicate better.
And then not everybody knows the age range for pediatric therapy.
Yeah, usually I see kids since 18 months, and right now my oldest one is approximately 18 years old. So I see a wide range of ages.
Pretty wide range.
Yes.
Yeah. And then
that's awesome.
Yeah. And then our Reed office, Sarah can also confirm whenever she gets a chance to hop on here. Reed is our first office, a little bit larger, and the team's been there a bit longer than we have been here. Our team's going to grow next month. We'll have Puneet here all the time, and we'll have another physical therapist joining us to be the team coordinator, Dr. Daly. She's phenomenal. Hopefully you'll get to meet her sometime soon. But at Reed, they have all of the same adult physical therapy services we offer here, but they also have more neurological based services. So rehabilitating something like after you've had a stroke, or if you have a balance disorder, they can make sure everything's done in a very safe and controlled environment to minimize any chances of falls or anything that you don't want to have happen when you're trying to get healthier and stronger. They have adult speech language pathology services over there. They also have occupational therapy, and they also have pelvic floor therapy and edema therapy. And
wow, you guys got some of everything.
Yeah, you do a lot
of information.
I want to let the audience know something real quick. These two locations, right now, Dr. May and Emily are at the what you call the Century Building, and that address is 2280 Opitz Boulevard, Woodbridge 22191. And I'll make sure I present a crawler on the screen so you get that information. It is on the campus of the main hospital of Sentara, Northern Virginia Medical Center. And for you who are from this area, the old Potomac Hospital. But we don't want you to think Potomac. We want you to think Sentara, Northern Virginia Medical Center. There has been a change, a very positive change. And that other location they'll talk about, that's Reed's Prospect out on Prince William County Parkway, Prince William Parkway. And that's not far from the Prince William County Center, over where the ball field is, where the baseball team plays. So those are the two locations. So Dr. May, I want to ask you this specifically. The people have heard about the services. They know that you provide physical therapy, chiropractic service. We know that massage therapy is on the way. We know that Emily's providing that tremendous speech therapy. But some people may be asking, well, why would I want to come see a chiropractor? What do I need a chiropractor for? How would you answer that?
That's a good question. It really depends on a case-by-case basis. Some of it comes down to what type of provider you've seen before and that you're comfortable with or that you prefer. Everybody has things they like more or less, and it's good to have options. There's a lot of overlap between physical therapists and chiropractors. There's a lot of very similar training, but there's also parts that are a little different. I'm somewhere that's kind of, because of the extra training that Sentara put me through at the University of Pittsburgh, my role is more of a primary spine practitioner. Basically, I'm like a quarterback for neck or back things. Maybe you go see your primary care, or maybe you have something really terrible happen. You go to the emergency department. All of our medical network knows that you can start your care with me for your neck or your back, and I'll make sure that I see you from start to finish. If you need a referral so that you can go see an orthopedist or a neurologist or a pain management specialist, or if you need a referral for a good formal course of physical therapy, some really in-depth strengthening or coordination exercises, I can get you there. I can make sure that you get to everywhere you need to be. And I'll also provide some conservative manual therapies, whether it's adjustments, some very gentle manual therapies, something like cupping, or teaching you some simple stretches to do from home. And when it comes to applying the therapies, that's where there can be a lot of similarities. But yeah, basically that's kind of my role, is to help make sure that you get to where you need to be. I help you there from start to finish. I'm keeping contact with you the whole time. And I'm also a part of the process of helping you heal, both by teaching you some things that you can't do, and also by using my hands to help you get there. Does that make sense?
That makes a lot of sense. So Emily, what if somebody's saying, well, why in the world would I want to go see a speech therapist? what kind of reasons would I need to see a speech therapist for?
Okay, so in that case, for example, when parents or even doctors start noticing that the kids cannot use words, like approximately at 18 months, they cannot use words to express their wants and needs. They cannot understand instructions, for example. We also see older kids that cannot pronounce words correctly, like specific sounds of speech, and people have difficulty understanding them. That's when they come here to see me. Um, Feeding difficulties, if the kids cannot eat a variety of foods, then I provide the tools and all the strategies that parents need to help them increase that uh, food repertoire and social skills. For example, when kids cannot interact with others, I provide tools like to start a conversation, maintain a topic. It's a wide range, like I said before. As a speech pathologist, I work on different areas. Um, Let me see what else. Fluency. If someone is stuttering, they can come here. I can help them to provide different strategies to slow down. Usually, when people stutter, the anxiety is also part of it, of what causes the stuttering. So I help them and I provide them the tools they need to have a fluent speech. Basically, that's all. Let me see what else.
Well, one of
I
the
get
Oh,
a,
that's a lot. That is a lot.
yes, it's a lot of things. So.
one of the really awesome things about having you here is where you were at before. You were in the school system, and
Yes.
most parents know that there can be some pediatric speech language pathologists in the school system, but there's only so many, and they can only see them so much during certain classes here or there.
Exactly.
And we know right now there's a lot of difficulty even being physically in school. Emily's here all week. She's
Definitely.
safe. She's here to help. And whether school was physically in session right now or not, if COVID wasn't a thing, she would still be here and she would be much more available for a lot more individualized one-on-one time for all of these things that sometimes you just can't get enough of in the school system.
Well,
So
let me ask you this. I know this area has a lot of military veterans, and I know that the VA has the choice program where sometimes if their members do need chiropractic care or physical therapy, things like that, they do allow the veterans to use a facility that is close to their home. Do you offer that type of service to the veterans in the area?
yes, absolutely. I have military in my family, so I wanted to make sure that when I got here that I and our office were on their list of approved providers and facilities for chiropractic services and for acupuncture services. So
Oh,
that's
wow.
a very regular thing.
Oh, that is awesome. That is awesome. I tell you, it is impressive the amount of services that Sentara is providing. And let me ask you, many people are concerned about coronavirus. And I know that in your introduction, you did make a statement about, following protocols and being safe. If you could just speak to that to the audience so people can really have an understanding of what to expect when they come to the office as we go through this coronavirus protocol.
Well, we make sure that we follow all of the proper screening guidelines, phone calls beforehand, checking about traveling beforehand or during. We make sure that we have hand sanitizer or in multiple locations of every single room. We've got multiple hand washing stations. We have extra and emergency personal protective equipment if somebody is if they can't afford it or if they can't have it or if they don't have it. We have those things on an emergency basis. If somebody's coming in and they need some and they just don't have it, we can still make sure that you can get in. We can still make sure that you're protected, just like we're protected. We always wash hands before and after every patient. The rooms get wiped down before and after every patient. The desks, the tables, the equipment, the computers, the mouse, the door handles. We make sure that there's only so many people allowed in specific places in the lobby. While we enjoy a very fun and welcoming environment, right now we have to make sure that how many people are here are limited. So yeah, you can't bring your whole family in with you for your appointment so they can see it.
Right.
Right now, it's very
Can't
much
do it.
one-on-one thing. But yeah, I mean,
I think
I don't even, we have so many hand sanitizing locations on the walls, on the desks. I don't know how many there are offhand. There's a lot.
And in my case that I'm working specifically with kids, I make sure that we wash, both the patients and myself wash our hands before and after the sessions. And of course, I clean everything during the session, after the session, make sure that the tables and every toy or item that we use as part of the speech session is clean and disinfected.
And
wonderful.
We're even digitally and physically screened before we're allowed to come in each day. So we're made sure that we are okay to be here also. So we're checked too.
Awesome. There's a question from the audience, and I think this is for you, Emily. For someone who stutters, could there be a connection with their hearing?
Every case is individual, but mostly stuttering problems are related to anxiety. It can be to, like, for example, brain, any connection in the brain damage. So I cannot say specifically that can be a cause for it, but it's like I said, every case is individual. So we have to take a look at the person and see what is affecting them.
Got it. Well, this has been awesome. So much information has come forth. I do value your time. I want to know, is there anything that we missed? Anything that the audience needs to know about the tremendous services that you guys provide that maybe we didn't cover already?
I think we got to talk about most of all the big things. If you ever have questions, or if you want to know if anything new has come in, I know that there's the Sentara newsletter that goes out, and Sentara definitely likes the rehab team, so they make sure if we have anything new going on, it definitely gets put on there. We keep everything all updated on the website, including all of the safety and the cleaning protocols or guidelines we're following. So if you ever have questions or concerns about that, it's all on there. But yeah, I think we touched base on most all the big things. Both of our offices are open Monday through Friday. I know that Reed just expanded their hours a little bit because they had more patients requesting certain times, and that's always something we're flexible about. If the community needs a certain place, certain time, or a certain service, speak up, let us know, because we'll make sure that the community gets what they need. That's why we're here.
One final question. Do you guys take walk-ins, or is this absolutely appointment only?
How about you?
In my case, mostly, we always encourage to make appointments.
Okay.
My answer is yes. It's kind of both. It really depends. If you walk on in here and, well, if you walk on in here and you pass all the health screenings and everything's safe and okay, and I have the availability, absolutely. But it is a little tough. Our schedules are usually quite busy because we're making sure that everybody's safe and spaced out. If you're a new patient coming to see me, you're going to spend about 1 hour of one-on-one time with me. And that's pretty hard. If you were just going to kind of pop in here and try and guess what time or what day that is, odds are it's probably not going to be when you walk in. So it's usually best to try and call. Teresa is our administrative associate here. She runs the front. She's phenomenal. She's super friendly. She loves talking and meeting with new people. If you call in and ask, she'll let you know whatever's open the soonest, or if you have a certain time. She's great. But normally calling in is the safest bet.
Wonderful. Well, audience, you have it there. Sentara Therapy Center, located at 2280 Opitz Boulevard, Woodbridge, Virginia, 22191. If you need to call, 703-523-1680. And then there is a second location, as you see this address at the bottom of your screen, and that is the Sentara Therapy Center, Reed's Prospect, 4565 Daisy Reed Avenue, Suite 215 in Woodbridge. And their number is 703-523-8750, located right off of Prince William Parkway, not far from the Prince William County Government Complex over there near the field where the PW Nats play, Prince William Nats. I think that is the National Single A minor league baseball team. Well, Dr. May, Miss Emily, you have been a jewel for us today. Thank you so much for keeping our community informed. I would imagine that some people who are catching this live, and a lot of people catch us on the replay, some may have not even known that Sentara offers these type of services. And I just want to thank you. I want to give you an opportunity before we close out. Was there anything that maybe we didn't cover in the closing comments?
Just like you said, it's a very new thing up here because Sentara in Northern Virginia is a pretty new thing. Our office here has been open for about a year. This coming next week, one year. And RE has been open 1 year longer than that, so it is still very new. And if you didn't know that we're here, I'm not surprised because it's still very new. But yeah, if you have questions or anything, don't hesitate to reach out. We're here to help. We're here to answer questions. Wonderful.
I believe there was a famous rapper one time that coined the phrase, "If you didn't know, now you know." Well, thank you so much. I certainly appreciate it. Our audience appreciates it. This has been very, very informative. We thank you for taking your time. I would imagine on a normal day you would be in your cars headed home by now, but you have taken some time to spend with us, and we certainly appreciate it. Thank you, Dr. May. Thank you, Emily. We appreciate your time.
Anything for you, Carl.
Thank you so much.
All right, audience. We thank you for your time and attention. Please don't forget, there are 2 locations in Woodbridge, Virginia, Sentara Therapy and Rehab Services. One over on the main campus for Sentara Northern Virginia Medical Center, and one in Reed's Prospect. And our audience member, Miss Princess French, she says, very informative. Thank you. So you have affected our community, and we thank you so much for that. Thank you for being here for us, Princess. We appreciate you. All right, audience, until next time, as I always say, may God bless you and may heaven smile upon you. You have a good evening.
Take it easy.